tabled by Honorable John Dogashino, Chairperson, Committee on Lands, Physical Planning, Housing and Urban Development.
Very well. Honorable John Dogashino, Chairperson, Committee on Lands, Physical Planning, Housing and Urban Development, and member for Kanjueri Reach.
Honorable Speaker, on behalf of my chair, Honorable John Dogashino, we would like to table a preliminary report or a request on Milo Inya annual report and financial statements for the financial year ended 30th June 2025. Honorable Speaker, the Committee on Lands, Physical Planning, Housing and Urban Development has been considering the Milo Inya Municipality Annual Report and Financial Statements for the financial year ended 30th June 2025. The committee has conducted sittings on the matter and has since compiled its report. However, the members are yet to proofread and formally adopt the report. In light of this, Mr. Speaker, the committee respectfully seek an extension of 7 days to allow sufficient time for members to review, finalize, and adopt the report on the Milo Inya Municipality Annual Report and Financial Statements. Accordingly, Mr. Speaker, I humbly request that this House grants the committee the additional time required to conclude its consideration of the report. Your indulgence and support in this regard will be highly appreciated. It's signed by the Honorable John Dogashino, MCA, Chairperson, Committee on Lands, Physical Planning, Housing and Development, Urban Development Chair, who has given me the mandate to lead on behalf.
Thank you, Honorable Gashino. Honorable Ibra. Yesterday, Honorable Ngesha did raise a concern, and I appreciate that you have commented you've been mandated. And I encourage all members to be saying they have been mandated to avoid masqueraders. The leave sought has been explained and deserving, and so I grant it as sought. So ensure that it's tabled within the same timeline. Clerk, next order.
Order number 6, notices of motion. Mr. Speaker, sir, we have 2 notices to be given by Honorable Duncan Gethenji Chege, Chairperson, Committee on County Public Accounts and Investments.
Very well. Honorable Duncan Gethenji Chege, Chairperson, Committee on County Public Accounts and Investments.
Thank you, Mr. Speaker. I beg to give the notice of the following motion that this House does adopt the report of the Committee on County Public Account and Investment on the report of the Office of the Auditor General of the Engineer Municipality for the year ended 30th June 2025 as a report of this House and recommendation therein as the resolution of the House. The second one, Mr. Speaker, is that this House does adopt the report of the Committee on the County Public Account and Investment on the report of Office of the Auditor General on the Nyandarua County Health Facility Improvement, financing the fund for the year ended 30th June 25 as a report of this House and the recommendation therein as a resolution of the House. It's okay. Thank you, Mr. Speaker.
Thank you, Honorable Duncan Gethenji. Notice of motion is duly given and the same shall be processed as directed by the House Business Committee, that is pursuant to Standing Order 5D. That is on the first one, that this House does adopt the report of the Committee on County Public Accounts and Investment on the report of the Office of the Auditor General on Engineer Municipality for the year ended 30th June 2015 as a report of the House and recommendations therein. In regard to the report of the Committee on the County Public Accounts and Investments on the report of the Office of Auditor General on the Nyandarua County Health Facility Improvement Financing Fund for the year ended 30th June 2025 as a report of the House and recommendations therein as a resolution of the House. The notice of motion has been duly given and the same shall be processed as directed by the House Business Committee, that is pursuant to Standing Order 157(5)D. Clerk, next order.
Mr. Speaker, sir, order number 7 on statements. We have a statement response to be given by Honorable Paul Ngesho Wambaire, Chairperson, Committee on Health Services.
Very well, Honorable Paul Ngesho Wambaire, Chairperson, Committee on Health Services and member for Kipipiri Ward.
Thank you, Mr. Speaker, sir. Honorable Speaker, pursuant to Standing Order 46(2)C, on the 17th day of February 2026, Honorable Milka Wajiro Drango sought a statement from the committee concerning the status and management of the Beyond Zero initiative in Nyandarua County. Mr. Speaker, 5 issues were to be addressed. 1, the current status of Beyond Zero mobile clinic in Nyandarua County, including their physical location, schedule, functionality, and the range of services presently offered. Number 2, clarification on whether the mobile clinics are managed under the Nyandarua County Department of Health Services, the National Ministry of Health, or any other administrative arrangement. Number 3, details on staffing, funding, maintenance, and day-to-day operational responsibility of the mobile clinic. And number 4, confirmation on whether the Beyond Zero initiative is still operational in Nyandarua County, and if so, the scale and frequency of its activity, including the number of patients attended to in the last financial year across the county. Number 5, clarification on whether the Beyond Zero mobile clinic can be used for other services, including delivering medication to people in villages in close proximity but far from the health facility. Mr. Speaker, we acknowledge the Committee on Health Services because it's one of the sector committee with a very critical role in the county. I appreciate the rigorous execution of the mandate of representation and oversight by the members, and I also wish to thank your office and that of the clerk for facilitating the committee and offering the relevant technical expertise through the secretary in pursuing its core mandate. I extend my appreciation to the members of the committee for their commitment and believe that we shall continue to expedite our mandate with diligence and goodwill for our electorate. Mr. Speaker, sir, on behalf of the committee, I present this statement response to the House for consideration and adoption. Issue number 1, the current status of Beyond Zero clinics, including their physical location, schedule, functionality, and range of services offered. We have the management response. The physical location, we have Daragwa sub-county. It covers Daragwa and Orjoro sub-county. We have Orkarau sub-county, that is clinic location. Orkarau sub-county, we have Kipipiri, Orkarau, and the Kinangop sub-county. The functionality, the clinics are functional and are deployed during scheduled, mark the word, scheduled outreach activities. However, operations are conducted on a limited scale due to prevailing resources constraints. The range of services offered by this clinic, Roman 1, we have maternal and child health services. Roman 2, family planning services. Number 3, antenatal and postnatal care. Number 4, immunization services. 5, basic outpatient consultation. Number 6, health education and preventive services. Issue number 2, clarification on whether the mobile clinics are managed by the Department of Health Services, Nyandarua County, the National Ministry of Health, or any other administrative arrangement. Although the initiative was launched nationally under the Ministry of Health, the Beyond Zero clinics in Nyandarua County are fully managed by the county government of Nyandarua. Operational management is undertaken by the Department of Health Services, Nyandarua County, and now the respective sub-county health management teams. There are no alternative administrative arrangement outside the county government of Nyandarua structure. Number 3, details on staffing, funding, maintenance, and day-to-day operation of the mobile clinics. The staffing. There are no permanently stationed technical support staff assigned specifically to the Beyond Zero clinics due to shortages of nursing and other technical personnel. Staff are temporarily deployed from health facilities during outreach activities. Upon completion of outreach services, the staff return to their respective duty stations. Funding. There is no dedicated budget allocation for the Beyond Zero clinics. Operation are supported through sub-county level resources and facility level support mechanisms. So what are we saying? Is that if you want to have these clinics, talk of facility like Kidemi, they need to come up with the budget. Then they just request that we need this Beyond Zero clinic. So we have maintenance. The mobile clinics are maintained by the county government of Nyandarua through the office of the county secretary. You know the fleet management. It falls under the county secretary. C, we have day-to-day operational responsibility. Deployment and coordination are managed at the sub-county level based on identified outreach needs and availability of logistical support. Number 4, issue number 4, confirmation on whether the Beyond Zero initiative is still operational in Nyandarua County. If so, the scale and the frequency of activities and the number of patients attended in the last financial year. The Beyond Zero initiative remains operational in Nyandarua County. However, activities are conducted at a reduced scale due to shortage of technical staff, limited operational funding, particularly fuel, inadequate medical supplies, and outreach resources. The scale and frequency of activity vary depending on outreach, scheduling, and resource availability. Patients' attendance fluctuates accordingly based on the level of operational support during each outreach period. So here you can identify the gap. The data, there is no data here because it is as if the Beyond Zero has been devolved and nobody is caring about it, what ought to be done. So they don't have the data. Number 5, clarification on whether the Beyond Zero clinic can be used for other services, including delivering medication to people in villages in close proximity but far from health facility. The Beyond Zero clinic are primarily designed as mobile consultation and service delivery unit. However, internal space within the clinic is limited. Medical equipment is permanently installed inside the unit. There is insufficient capacity to transport bulk quantity of drugs or health commodities. Additional loading may pose a risk of damage to the installed medical equipment. Therefore, while limited medication dispensing during outreach activities is feasible, the clinics are not structurally suitable for bulk transportation and distribution of medicine to villages. So the key challenges facing Beyond Zero initiative is shortage of technical staff, lack of dedicated operational funding, limited fuel allocation, insufficient outreach medical supplies, and now we have the analysis and the finding by the committee and also the observation. The status and deployment of Beyond Zero clinics is that we only have 2 Beyond Zero mobile clinics located in Daragwa sub-county and Olkarau sub-county. The clinics are not permanently stationed for continuous service delivery, but are deployed only during scheduled outreach activities. Although reported as functional, their operational capacity is limited due to resource constraint. when you go to governance and administrative responsibility, the committee is find that although the initiative originated at the Ministry of Health, operational responsibility rests entirely with the Nyandarua County Government. Members, you should note this. National government sometimes is doing disservice to the counties. They will start something, then pass it to the county government without structures. You recall Margaret Kenyatta, the first lady by then. This was her initiative. And this initiative now, she carried the vision and mission. It was a success by then. But today, when you even look at even the other county, there is no structure. So we have this initiative originating from the national government, but they are left hanging. Number two, we have day-to-day oversight is undertaken. So there are no joint management structure with the national government. It is just there. Full devolution of operational responsibility to the county appears to have shifted the financial and staffing burden to county resources. The absence of continued national level operation support may have contributed to reduced scale of activities. Then the issue of staffing and human resource capacity. The Beyond Zero clinic do not have permanently assigned staff. Healthcare personnel are temporarily deployed from existing health facilities. So the staff will return to their original facility after each outreach. So nobody is responsible. And there is temporary deployment may disrupt services in fixed health facilities. You find your nurse from Shamoka. She is in the Beyond Zero. Her station should be Shamoka. So what happens? Disruption of services. The absence of dedicated staff indicates that the clinic are not institutionalized within the county health workforce structure. Then on the issue of funding, there is no dedicated budget allocation. So lack of specific budget line significantly affects the sustainability of the initiative. Reliance on ad hoc funding sources limits the ability to plan regular outreach schedules and also to ensure consistent service delivery. So when you talk of maintenance and asset management, lies within the office of the county secretary. In other news or in other war, you see how the floodlight and that particular vehicle that is supposed to be maintained, what is happening to that vehicle. If that now it is at the county secretary office, the Beyond Zero, suppose also we want to maintenance, repair. So central maintenance at the county secretary may delay technical servicing and operational readiness. The presence of fixed equipment limits the flexibility of the units for other logistical functions, such as drug distribution. So when we talk of operational scale and the service utilization, the absence of data on service utilization limits the committee ability to assess the impact and the value for money of the initiative. Lack of performance indicators suggests weak monitoring and evaluation mechanism. So lastly, a limitation on alternative uses. The structural design of that particular vehicle restricts the clinic use as a pharmaceutical distribution unit. However, they remain useful for community-based primary care outreach. Even when you look at Kangata, Governor Kangata, he has a kind of Beyond Zero. When it is dealing with the issue of renal, it is only renal. It can only accommodate one service. So in nutshell, Mr. Speaker, from the committee analysis, finding and observation, it is evident that the Beyond Zero Clinic in Nyandarua remain a potentially valuable public health asset, but are currently operating below their intended capacity. Whereas the initiative continues to support critical primary health services, particularly maternal and child health, family planning, immunization, preventive health education. Its impact has been significantly limited by structural, financial, and operational constraints. So, in this regard, Mr. Speaker, the committee emphasizes the importance of introducing adoption, a formal motion to have the Beyond Zero initiative captured as a distinct program within the county budget, institutionalizing the initiative. In this manner would enable the county government to provide a dedicated budget line, thereby ensuring consistent funding for operations, staffing, logistics, and maintenance. Such budgetary allocation would significantly enhance the sustainability, predictability, and overall effectiveness of the program. Capturing the Beyond Zero Clinic as a budgeted program would not only strengthen service delivery, but also enable better planning, monitoring, and evaluation of outreach activity. This would allow the county to more effectively utilize the clinics as strategic tool for expanding access to primary health care services, particularly maternal and child health services in undeserved communities. Like in Ireshaufodo, we once brought a container kind of dispensary. So in those areas, we need even this Beyond Zero to. Ultimately, the committee concludes that with the proper institutionalization, adequate funding, and strengthened operation support, the Beyond Zero clinics have the potential to play a critical role in advancing equitable healthcare access and improving health outcome across Nyandarua County. So, Mr. Speaker, we appreciate the honorable member, Honorable Wanjiru Milka, because it is not about witch hunting. It's about getting information, and now getting this information, perfecting where we are going wrong as a county. As a chair, I cannot come here and defend and say that the Beyond Zero is functioning very well. It is not functioning very well. But now, the member has done her legislative role. We will be able to, as a committee, to follow this. And it will now become functional. And it will help and will achieve whatever the Nyandarua County government wishes to achieve. But more so, our people will be happy. So we can be able to do better than this. Thank you, Mr. Speaker.
Thank you, Honorable Ngeshe. Yes, Honorable Milka, the seeker.
Thank you, Mr. Speaker. And allow me, Speaker, first to say thank you to the Health Committee. Indeed, this is one of the best reports that they have done, and I want to appreciate the chair and the members of the committee because of bringing such a detailed report in this assembly. Members, you will agree with me that the issue of Beyond Zero is not a personal issue, as the chairman said. It's an issue that touches the lives of our people. It's an issue that is very, very close to our hearts. An issue that, if taken seriously, can save lives in this county, Mr. Speaker. Therefore, Mr. Speaker, I really appreciate that. I really appreciate the research. And of course, when we raise a statement, Speaker, in this assembly, of course, this statement must lead to something else. And as Honorable Ngeshe has said, this statement must lead to something else that will ensure that Beyond Zero Clinic is operational in Nyandarua County, because that is an equipment we have. It doesn't matter whether it was stopped at the national level, but it is public resources that were used to buy the clinics, and they were brought to this county. So we cannot just say it was being operated by the national government. It was brought to this county. So what were we supposed to do after that program for the national government ended? Were we to keep it and not utilize it? I think we ought to have thought beyond that and think of a way of operationalizing the Beyond Zero Clinic. Why I had requested this statement, Mr. Speaker, is because, as I indicated the other time, we visit our villages. And deep down in our villages, I would say the living standard of our people, because of the nature of the economy of this country, have deteriorated. And sometimes when you visit the elderly, when you visit the sick, because personally I do a lot of compassionate activities, visiting the sick and visiting the elderly, you'll find that somebody was not able to go to Fali to get medication. You'll find somebody do not have fare to go to Nyahururu Hospital, referral hospital, to get medication, simply because he does not have even 100 shillings or 200 shillings fare to go and get medication. Therefore, Mr. Speaker, our thought behind this was whether we can get these services close to our people. And I'm happy because we have the report now that we already have 2 mobile clinics, one that is stationed in Daragwa, serving Daragwa and Old Jororok, and the other one stationed in Old Kalau, serving the other 3 sub-counties. That is a starting point. And then, of course, they have indicated the services that are offered, which are good. But there is one important thing, and the chair, you will also seek a more clarification of this. When you say that they cannot transport drugs because of the bulk nature, how many kilograms of drugs will be to take to just a small sublocation? Does it mean then a pickup cannot carry those drugs? How heavy are they? How bulk are they? What is this bulk they are talking about? Bulk transportation. Because I believe the medication that they take per station, it is only a small box that they will go share medication for only the sickly. Not every person in the community is sick. They are not going to give everybody medication. They are only going to give the sick person's medication. So when they say bulk transportation of drugs is a challenge, what do they mean by bulk transportation? The other issue also is the issue of allocation of fund. From the report, I have seen it. They have not given us the schedule. We had requested that we would want to know the schedule. Yes, they have said there is a schedule, and they have not indicated that schedule. They have only said that there is a schedule. That means there is no schedule, because if there was a schedule, they would have indicated that. The other issue is about the staffing. And this is where I'm concluding. From the report, Mr. Chair and Mr. Speaker, I've noted little or zero interest in operationalization of the Beyond Zero. Because if there was interest to operationalize the Beyond Zero, at least they would have set it as a program in the budget and request for allocation of fund. It's now the 4th year we are doing the budget, yet they have not included it in the budget. So that means they never saw the importance of putting money in the budget for the Beyond Zero clinics. Number 2, there was a time, I remember there was a time nurses were employed. Did they request for nurses or for personnel to serve in the Beyond Zero? That means they did not have interest then for because they did not request the staffing they are talking about. Therefore, Mr. Speaker, in conclusion, this is a very, very important statement. And I wish, and I'm happy that the committee also have seen that we need to bring a motion in this house, and I will do it, to compel this government that Beyond Zero becomes a program in the budget of this county and among the programs of this county. Because that way we will compel them, because they have money for health. We allocate, the health is one of the departments that gets a lot of money. So we allocate money for that program, and we can be able to utilize that program, and we can be able to get a health working nation. So therefore, Mr. Speaker, With all the indulgence, I request my members that we go through the statement, we see how we can help, we bring a motion in this assembly so that we operationalize the Beyond Zero clinics, because those are resources for the county and they cannot go to waste. And again, talking about allocating some money here, temporary staff here, how do they account for that? Accountability is also lacking. So for there to be accountability, there must be a programmed way of running Beyond Zero. So therefore, Mr. Speaker, with those very many remarks, thank you for the opportunity. Thank you, committee, for that. But we shall be bringing a motion in this assembly to operationalize the Beyond Zero. Asante.
Thank you. Honorable DS.
Thank you, Mr. Speaker. First of all, Honorable Speaker, is to thank the seeker of this statement, Honorable Milka Wajiro, Smart Brain. And why I thank her, because, Mr. Speaker, this is one of the greatest initiatives by one of the first ladies who ever occupied the office of the first lady in Kenya that has touched most of the lives in this country. Mr. Speaker, I also want to thank the Health Committee, chaired by the able chair, Honorable Geche, for such a good research and a good source of information. Mr. Speaker, kindly allow me to bring to your notice the work that has been done by the Health Committee over the years in this particular assembly. They have done exemplarily well, and they must be applauded for that. Mr. Speaker, commenting on this particular initiative, the Beyond Zero mobile clinics, that was started by Her Excellency, former First Lady Margaret Kenyatta in 2014, with the name to aid maternal and child preventable deaths. Mr. Speaker, this initiative definitely was to came to supplement the health services that were being offered, having recognized that some communities were disadvantaged, they were underserved, and they used to suffer a lot. And Mr. Speaker, this initiative, the Beyond Zero mobile clinics, attracted a lot of funding. But this taught me a lot, Mr. Speaker, that if we are careful to use our positions of influence to benefit our communities, other people will come and join hands because they have seen something unique, organization. And that is what is really actually needed for any initiative to succeed. Mr. Speaker, if we pick from where she left and find the gap and fill it, this initiative will continue to help our community a great deal. Yesterday, I attended a health committee, and there was a great revelation on how we are even having problems trying to feed even the newborns whose mothers unfortunately pass on and the child is left alive, where we don't even have non-supplements, the food for the child, and they have to survive with the cow's milk. And it shows that there is a lot happening in our society. If that is happening in the hospitals, where we don't have the equipment or the food that nutritionists need to feed these children, then what is happening in our interior areas, in our communities that are a bit marginalized. It is in support of what Honorable Ajiro has said, that we need to have a way forward. We cannot let such a great initiative just die. We cannot. If we are leaders worth our salt, we must wake up and decide where Her Excellency Margaret Kenyatta left, we shall pick up from that. And that tells you, Honorable Speaker, who has a human heart. A very privileged woman who can access health care everywhere in the world, but she minds about her fellow women who are suffering from obstetric, fistula, maternal death that can necessarily be avoided, and early and she managed to reduce mortality rate of children to almost zero. Honorable Speaker, you wonder sometimes how sometimes we are deceived when we think that we are getting a better government, then we get a worse government. Because this was definitely a great idea, that if anybody ever thought of the hustler people, of those people who are suffering, the low people, then this is an initiative that would have grown in bounds, and an initiative that would have even attracted government, national government funding. And when we see some other fundings that will happen, then we wonder what are our priorities. We wonder whether we care about our fellow human beings who are not as privileged as we are. So therefore, Mr. Speaker, I really support this reporting, and I support the initiative that we move from there and fill the gaps. Let us be organized such that even other companies, because Beyond Zero, Honorable Speaker, was funded partly by the government. Also, it was funded by global organizations like UNICEF. It was funded by World Bank. And it was funded by private companies like Unilever, Safaricom, and others in their social responsibility, contribution to the society. Therefore, Mr. Speaker, let us be careful even when voting for a government. Let us know those who have human heart. Thank you, Mr. Speaker.
Yes, thank you, Honorable Diaz. Honorable Kagwe.
Thank you, Mr. Speaker, for giving me this chance to talk to the ongoing debate. And Mr. Speaker, first I'll take this opportunity to congratulate the seeker of this statement. Mr. Speaker, that is the member from Kireita, Honorable Mirka Wajiro. Mr. Speaker, this is one of a statement of its kind, realizing where we are as a country, Mr. Speaker. And Mr. Speaker, just go dialect to what we call the Beyond Zero, Mr. Speaker. And Mr. Speaker, its original mandate was to address the maternal health care for our mothers and the children. And Mr. Speaker, when these Beyond Zero are being brought to this county or this country, Mr. Speaker, the First Lady or the fourth President of this Republic was gracious enough to talk to non-government organization and also to seek support also from the national government so that she could be able to address the mortality rates of our mothers and our children. And Mr. Speaker, we are somehow disappointed, having understood that when Beyond Zero came, it was very good initiative. And I remember 2014, particularly I talk on behalf of Daragwa Central people, we benefited with it because we opened 2 outreach clinics, Mr. Speaker, where our families and our voters, they knew each and every Tuesday they were heading to Kamerori. Each and every Friday, they were heading to Kihara. And Mr. Speaker, you could realize the importance of that Beyond Zero. Mr. Speaker, you could go there and you get more than 200 mothers waiting for that facility. Today, Mr. Speaker, those women, they have either now to walk or use border to go and seek the services to the nearest health center. So, Mr. Speaker, as I support Honorable Milka, because I have heard the committee has said that it's going to bring a comprehensive, we are going to bring a comprehensive report, but the motion will serve as better, Mr. Speaker, so that at least some steps can be taken. Mr. Speaker, as I write, it's important we note that those Beyond Zero, particularly the one in Nyandarua, it will only wait until when there will be a big function within the region. That's the time it will get that bus there, because I call it a bus, with 2 nurses, Mr. Speaker. But after all, nothing will do. All there is a big barrier. They will be just be asked to offer the services of first aid. And Mr. Speaker, I do understand that time, as much as department can say that it cannot carry drugs, how are they carrying that time, 2014 to 2022? Because I know they were operational. And Mr. Speaker, we are not talking about a lorry. We are just talking of just drugs, because our medical officers, they know the prevalence of what affects us. So they know if they go to Kanyagia, they know these are some of the diseases we are going to get there. So, Mr. Speaker, I feel it's important as we address the primary health care. Mr. Speaker, let us utilize this gadget, this machine that we were given by the national government, and also the well-wishers. Mr. Speaker, I know, maybe you, the way I know you, you're one of the well-wishers who contributed to this agenda, because it was money from the people. How would you feel when you see a machine just lying idle within Olkalao or within Daragwa dispensary or the Daragwa level 4 without movement? Then what will come after is just a mechanical problem, Mr. Speaker. And when you talk about mechanical problem, Mr. Speaker, and I don't want to change the debate, we have the vehicle from Dolo department, which was supposed, Mr. Speaker, to be used by engineers to connect floodlights. It has taken 2 years. 2 years, Mr. Speaker. So, Mr. Speaker, let us use those things we are given by the government for them to change the lives of our people. So, Mr. Speaker, I support the good initiative of having a motion so that as this bunge, we can be able to even look for some funds. Let Beyond Zero start as a department. Let us allocate some fund for it. Let us have staff who are 24/7 allocated to Beyond Zero, Mr. Speaker. And Mr. Speaker, with that, we'll see the importance and the value of the money that the government has been giving to this county. So, Mr. Speaker, I write it there, and I support the committee 100%. They have done a very good job for giving us with that report, and mostly important, Mr. Speaker, I support Honorable Milka that she has done a very good thing to seek this statement, and also suggesting that in the near future she's going to table a motion in this House. Thank you, Mr. Speaker.
Thank you, Honorable Kagwe. Yes, Honorable Motimo.
Mr. Speaker, I want to take this opportunity to really thank the Health Committee led by their chair. Mr. Speaker, this one committee that I can say in this honorable house, we are proud of them because of the good work and the timely reports that they do deliver in this honorable house. Unlike the sports committee that, Mr. Speaker, has business that has been pending all through. Mr. Speaker, I think this is a program that has been running since it was started. Mr. Speaker, there are members who are consulting in very high tones here.
Maybe members who can consult in low tones so that we can listen to the member.
Thank you. This is a program that has been running, and I think, as Honorable Wanjiro has just mentioned, is that what we need to do is just to go back to where it stopped. Because, Mr. Speaker, like it has been mentioned, this track used to go around our various wards where our people or health facilities were a bit far, and they were giving services to our people. Mr. Speaker, health is a devolved function, so money is within ourselves. What we need to do is to put structures in place and to ensure that, Mr. Speaker, we have everything that it takes. Even if it's to dedicate staffs, particularly for the Beyond Zero track, that they will be going around each and every ward as they used to do, to ensure that, Mr. Speaker, our people get this service. I want to concur with Honorable Wanjiro that very soon she can come with the motion, with the resolution, so that, Mr. Speaker, we forward the same to the health department, so that going forward we can have a structured way to run the Beyond Zero track, so that, Mr. Speaker, it can be of great help to our people. With that, I support.
So thank you, members, for that contribution. So, Clerk, move to the next order.
Order number 8, motions and bills. Mr. Speaker, sir, we have a motion to be moved by Honorable Peter Denji Kirega, Chairperson, Committee on Special Funds Accounts.
Very well. Honorable Peter Denji Kirega, Chairperson, Committee on Special Funds, member for Rudi Ward.
Thank you, Mr. Speaker. This is the report on special fund that was tabled on 4th March 2026 at 9:30 a.m. The report on the annual financial statement of the county executive, that is states and public officers, car loan and mortgage fund for the financial year 2024-2025. Mr. Speaker, due to your skill and ability, the committee has managed to deal with this. Mr. Speaker, being the chair of the committee, I have 9 members who we are doing the work together so that we can come up with a better report. Mr. Speaker, we have also, in addition, the clerks, that is the committee clerk, Patricia Shege, Simon Mwago, who are taking the mandate. Mr. Speaker, we have the roles that are supposed to be dealt with legally through the standing orders. And Mr. Speaker, we deal with the County Executive Committee, members, car loan and mortgage fund scheme. We have Nyandarua County Civil Servants car loan and mortgage fund scheme, the Nyandarua County Emergency Fund, Nyandarua County Assembly members car Loan and Mortgage Fund Scheme, Nyandarua County Assembly Staff Car Loan Mortgage Fund Scheme, Nyandarua County Gratuity Fund, the Nyandarua County Pensions Funds, and lastly, such as the funds established by the law and as the speakers may deem. Mr. Speaker, we have terms and evidence which are listed below the report. And Mr. Speaker, we have the legal and the regulatory framework that guides that guides us to come with this report. Mr. Speaker, this is Section 116 of the Public Finance Act of 2012, which allowed the county to create special funds for the specific purpose. Its operations are guided by the Mortgage and Regulations 2022, which provides clear rules on how the fund should be managed. The purpose and the benefits of the fund, Mr. Speaker, was to improve the welfare of county employees by making it easier them to own homes, mortgage vehicles, access affordable loans, helps employees reduce financial stress, and improve the quality of their life after services of their tenure. Mr. Speaker, we have the management and control of fund. And Mr. Speaker, this is the key point. The fund is managed through establishing structures as provided for the regulation. These structures are responsible for reviewing loan application, approving loans, and monitoring the payments to reduce the risk of loan default. Repayments are mainly recovered through the payroll system, regular checks, and the reports are also carried out to ensure the fund is used properly and remains sustainable. Financial reporting and the accountability included in the report shows the financial position and the performance of the fund for the period under review. They have been prepared in line with the required accounting standards and legal requirements. The statement, Mr. Speaker, provides information on the loans issued, repayments received, outstanding balances, and administrative costs. That helps the county assembly and other stakeholders to monitor the fund and ensure accountability. Mr. Speaker, there is observations of the committee and findings which are there below. There is analysis of non-financial information which are yes, Mr. Speaker, there is legal establishment of the fund, Mr. Speaker, composition of the fund administrative committee there below, and a lot of tabulation in it. Mr. Speaker, there is approval of financial statement in this report. Mr. Speaker, we have the analysis of financial information, the statements of financial performance of the year ended 30th June 2025. During the financial review, Mr. Speaker, the fund realized a total or revenue of Kenya shillings 17,133,675 shillings against expense of Kenya shillings 17,012,798 shillings, resulting to the surplus of Kenya shillings 120,877 shillings. Mr. Speaker, there is a revenue performance there, the expenditure performance, which shows the add the value to the information that we were seeking. Mr. Speaker, the statement of financial position for the year ended 30th and June 2025, the committee had a note that we found. This was the assets totaling of Kenya shillings 615,704,324 shillings. These assets were primarily made up of the long-term loans, which amount to 522,276,230 shillings, representing the principal amounts lent to eligible officers under the fund. Mr. Speaker, current portions of long-term loans, that was 908,982 shillings, which relates to the portion of loans expected to be repaid within the next financial year. There is bank balances of Kenya shillings 21,560,275 held in the family bank account number 037-000-11609, representing liquid funds available for the operation and loan disbursement purposes. Mr. Speaker, the committee further observed the fund's total liabilities were minimal, amounting to Kenya shillings 41,163, which arose from a loan overpayments by single loanees. The committee also noted that the fund's net assets were financed through the combination of the source as follows: the accumulated surplus of 120,877, representing sustained earning from the previous financial year, the revolving fund opening balance for the year, Kenya shillings 585,583,477 shillings, which forms the bulk of the fund's capital and is available to sustain leading activities. Capital fund stroke transfers of the year, 70 million, representing additional contribution made to the fund during the year. Mr. Speaker, there is overall committee observation that the fund maintains a strong and stable financial position and underpinned by the substantial loan portfolio and the healthy opening revolving fund, which minimal liabilities. The fund demonstrates prudent financial management and effective oversight, positioning it to continue meeting its mandate to providing car loans and mortgage facilities to eligible county executive officers. Number 3, statement of cash flows for the year ended 30th June 2025. That was the cash flows from the operating activities. B, cash flows from the investing activities. Mr. Speaker, the committee observation, the revenue performance is here within. At the page 16, there is the expenditure performance, overall performance, and therein there is a tabulation of the statements of change in net assets for the year ended 30th June 2025. Mr. Speaker, we have the recommendation of this report. that Mr. Speaker, having examined the annual financial statement of the county executive, states and public officers, Caron and Mortgage Fund for the financial year 2024-25 and pursuant to its mandate under standing order number 197 bracket 2, the special funds accounts committee makes the following recommendation: that the fund administrator committee puts in place measures to control and reduce administrative costs, including bank charges and related expense, which currently consumes a significant portion of the fund's revenue. Mr. Speaker, the Fund Administration Committee does regular reviews of operation expenses to ensure that the larger share of the income is available for the leading and to improve the fund's sustainability. Mr. Speaker, there is conclusion. Mr. Speaker, in our conclusion and summary, the County Executive Caron and Mortgage Fund has played a pivotal role or important role to providing financial support to the county executive, states and public officers, enhancing their welfare while ensuring prudent physical oversight. Lastly, Mr. Speaker, on the other hand, the county assembly remains committed to supporting measures that promote transparency, accountability, efficiency in managing public resources, ensuring that the fund continues to serve its intended purpose effectively. Thank you, Mr. Speaker. Mr. Speaker, I request Honorable Joyce to give a second.
Thank you, Mr. Speaker. As a member of the committee,
Honorable Joyce, you want to give a second, or you are seconding? Yes, proceed.
Thank you, Mr. Speaker. As a member of the committee, I wish to second and really insist on the issues that have really been raised, especially the recommendations. We remember, like last week, we had something from the Auditor General where the same issues had been slotted in. So we really call upon the executive to ensure that the recommendations that have been given are taken into account. And maybe in addition to that, the matter that had came up last week about the funds, the 13 million that was supposed to have been returned to this fund to ensure that we have more resources to be able to ensure that the program continues. We hope that that also will be acted upon, and those resources will be refunded. Therefore, Mr. Speaker, I second.
Thank you, Honorable Joyce. I now propose the question, which is that this House does adopt the report of the Committee on Special Funds Account on the Nyandarua County Executive, State and Public Officers Car Loan and Mortgage Scheme Fund, annual report and financial statements for the financial year ended 30th June 2025 as a report of the House, and the recommendations therein as a resolution of the House. I now put the question, which is that this House does adopt the report of the Committee on Special Funds Accounts on the Nyandarua County Executive. Pardon, I went wrong somewhere. On the I propose the question, which is that this House does adopt the report of the Committee on Special Funds Accounts on the Nyandarua County Executive, State and Public Officers Car Loan and Mortgage Scheme Fund, annual report and financial statement for the financial year ended 30th June 2025 as a report of the House and the recommendations therein as a resolution of the House. I now put the question, which is that this House does adopt the report of the Committee on Special Funds Accounts on the Nyandarua County Executive State and Public Officers Car Loan and Mortgage Scheme Fund annual report and financial statement for the financial year ended 30th June 2025 as a report of the House and the recommendations therein as a resolution of the House. May those of a similar opinion say aye. May those of a contrary opinion say nay. And the ayes have it. Clerk, next order.
Mr. Speaker, sir, still on order number 8, we have a procedural motion to be moved by Honorable Duncan Githinji Chege, Chairperson, Committee on County Public Accounts and Investments.
Very well. Honorable Duncan Githinji Chege, Chairperson, Committee on County Public Accounts and Investments.
Thank you, Mr. Speaker. Mr. Speaker, I beg to move the following motion that pursuant to Standing Order 236, the motion that this House does adopt the report of the Committee on County Public Accounts and Investment on the report of the Office of the Auditor General on the Engineer Municipality for the year ended 30th June 2025 as a report of the House and the recommendation therein as a resolution of the House be exempted from the requirement of the Standing Order 50 that require a notice of the motion to be given at least 1 day before the motion appear on the order paper. Mr. Speaker, I call Mheshimiwa Ben to second as a member of this committee.
Thank you, Honorable Ben.
Thank you, Mr. Speaker. I second.
Thank you. I now propose a question, which is that this House does adopt the report of the Committee on County Public Accounts and Investment on the report of the Office of the Auditor General on the Engineer Municipality for the year ended 30th June 2025 as a report of the House and the recommendations therein as a resolution of the House be exempted from the requirement of Standing Order 55B that requires a notice of motion be given at least 1 day before the motion appears on the order paper. I now put the question, which is that this House does adopt the report of the Committee on County Public Accounts and Investment on the report of the Office of the Auditor General and the Engineer Municipality for the year ended 30th June 2025 as a report of the House and the recommendations therein as a resolution of the House be exempted from the requirements of the Standing Order 55B that requires a notice of motion be given at least 1 day before the motion appears on the order paper. May those of a similar opinion say aye. May those of a contrary opinion say nay. And the ayes have it. Clerk, next order.
Still on the same order, we have a substantive motion to be moved by Honorable Duncan Githinji Chege, Chairperson, Committee on County Public Accounts and Investments.
Very well. Honorable Duncan Githinji Chege, Chairperson, Committee on County Public Accounts and Investment.
Thank you, Mr. Speaker. Mr. Speaker, I beg to move the following motion that this House does adopt the report of the Committee on County Public Account and Investment on the report of the Office of the Auditor General on Engineer Municipality for the year ended 30th June 2025 as a report of this House and the recommendation therein as a resolution of this House. Mr. Speaker, just allow me to start with the acknowledgement. Mr. Speaker, the Committee on Public Account and Investment is a key player in enhancing the oversight of the role of this Assembly. We appreciate the honour members of the committee for diligently executing their mandate, noting that these are an historical report of the left pending by the Second Assembly. I also wish to thank your office and that of CRAC for facilitating the committee and offering the relevant expertise and support through the Secretary in pursuing its core mandate. Further appreciation goes to the honorable members of this assembly for their commitment and stout stand that we shall continue to expedite our mandate with vigor and goodwill for all our electorate. Finally, Mr. Speaker, sir, it's my pleasure and duty on behalf of this committee to present this report to the House for adoption. Mr. Speaker, because I know well that many of the members have the report, Mr. Speaker, I think I'll only go to the audit query on number 3. Audit query, late submission of financial statement to the Office of the Auditor General. Management of the municipality submitted the financial statement to the Office of the Auditor General 11 days late on September 10, 2025, instead of the statutory deadline of 30th August 2025. No explanation for non-compliance with the National Treasury Guidance paragraph 18, reference number AG 388, volume 41 of the December 2024, which directs all public sector entities for both national and county government to prepare and submit annual financial statement by 31st August 2025 to the Office of Auditor General with a copy of the Controller of the Budget, National Treasury and Commission Revenues Allocation. Okay. Management response. Since Engineer Municipality had operated under the executive in the financial year 2024 to 2025, her report had been included in the executive financial statement. Once communication was received on the need to prepare the independent financial statement, the report was prepared and submitted immediately. The management shall henceforth ensure the financial statements are finalized and submitted to the Office of the Auditor General within the statutory time frame. Committee recommendation. The committee resolved that any future failure to comply with the statutory reporting timeline shall attract automatic administrative sanction against the municipal manager, including stating breach of law and invocation of the disciplinary procedure in line with the public finance management. Mr. Speaker, just allow me to come to the committee's observation that the committee observed that query was sufficiently responded to and in conclusion, Mr. Speaker, the committee has concluded its examination of the Auditor General report of Engineer Municipality. The committee notes that while progress has been made toward the achieving operational autonomy, significant gaps were remain in budget execution, institutional compliance, and financial discipline. The committee emphasizes the need for strict adherence to the Public Finance Management Act, the County Government Act 2012, and other applicable rules to ensure the accountability and effective service delivery. The committee hereby submit this report to the County Assembly for consideration and adoption. Thank you, Mr. Speaker. And Mr. Speaker, I still call Mheshimiwa Ben to second.
Yes, Honorable Ben.
Thank you, Mr. Speaker. I second.
Thank you. I now propose a question, which is that this House does adopt the report of the Committee on County Public Accounts Investment on the report of the Office of the Auditor General on the Engineer Municipality for the year ended 30th June 2025 as a report of the House and the recommendations therein as a resolution of the House. I now put the question, which is that this House does adopt the report of the Committee on the County Public Accounts and Investment on the report of the Office of the Auditor General The AGM of municipality ended 30th June 2025 as a report of the House, and the recommendations herein as a resolution of the House. With those of a similar opinion say aye. With those of a contrary opinion say nay. And the ayes have it. So,
Mr. Speaker, sir, we've exhausted the business as indicated in the morning session agenda paper.
There being no other business to transact during today's sitting, I now hand the House to Wednesday, 18th of March 2026 at 5 p.m.
Our best.